Different patient positioning.
In order to avoid issues of immobility and injury, patient posture entails correctly maintaining a patient-neutral body alignment by avoiding hyperextension and severe lateral rotation. Placing clients is a crucial part of nursing practice and the registered nurse role. When a patient is positioned correctly during surgery, specimen collection, or other therapies, the surgical or treatment site is best exposed, and the patient dignity is maintained by limiting needless exposure. In the majority of scenarios, correct patient placement ensures physiologic safety, preserves body alignment, and manages airway and breathing.
Goals of patient positioning.
First, it maintains the patient's airway and circulations during the surgery is one of the objectives of optimal patient placement. Second, avoid nerve injury. Lastly, provide the surgeon access to the surgical site and space to administer anesthesia. Before you touch and interact with the patient or client, you must first conduct a proper hand washing and sanitize your hand.
Good day, ma'am. I'm Tiffany Faustino, your student nurse for today, and I'm going to assess your client positioning in order for your comfort and physical assessment.
Take note that I didn't ask her if it is okay with her because she's still a kid and doesn't know what's going on. But when you are assessing a client, you must always ask their permission.
These are the common patient position. First, supine position. The supine position refers to an individual's position on an examination or operating table. It involves the individual laying on their back with their arms at their side or abducted to less than 90 degrees. Examination of the hip and pelvis are also performed with the person in supine. Prolonged supine position can increase the risk for impaired respiratory function, including a reduction in lung volume, mainly if the individual is obese, pregnant, has pulmonary disease, or advanced age. It may also increase the risk for pressure ulcers of bony prominences and low vascular resistance. Second, prone position. Prone position is often used for spine and neck surgeries, neurosurgery, colorectal surgeries, vascular surgeries, and tendon repairs. The prone position produces an increase in functional residual capacity and alteration in the distributions of both ventilation and perfusion throughout the lungs. Prone positioning is also referred to as prone therapy, is used typically as a last resort because of lack of knowledge and or disinclinations of the clinician to use it. Third, Fowler's position. For shoulder surgeries and neurosurgery, the standard Fowler positions, commonly known as the sitting position, is frequently employed. The angle of the bed ranges from 45 to 60 degrees. The patient's legs could be straight or just slightly bowed. Surgery on the head, chest, and shoulders frequently takes place in this posture. Varieties of this position include low Fowlers, where the head of the bed sits at 15 to 30 degrees, semi-Fowlers with an elevations of 30 to 45 degrees, and high Fowler, which has the patient sitting nearly vertically. Fourth, lateral position. The patient is in the lateral position lying on one side. Back operations, lower extremity surgeries, thoracic surgeries, ENT surgeries, and kidney surgeries are few typical procedures that may call for a patient to be in the lateral position. Fifth, Sims position. In the conventional Sim position, the patient is lying on their left side with their right hip and knees bent. The thighs are flexed and the lower arm is behind the back. The left knee is cocked slightly. The right arm is relaxed behind the body and placed comfortably in front of it. Six, Trendelenburg position. In the Trendelenburg position, which is used in surgery, the patient is flat on their back with their feet elevated over their heads. Nowadays, lower abdominal surgeries such as colorectal, gynecological, and genitourinary procedures frequently used in the Trendelenburg position. The intra-abdominal organs are pulled away from the pelvis by gravity in this position, facilitating easier surgical access to the pelvic organs. For operations like colorectal, gynecological, and genitourinary surgery, the Trendelenburg position gives a surgeon better access to the pelvic organs. Prior to placing a patient in the Trendelenburg position, like with all surgical positions, hazards must be considered. 7th, reverse Trendelenburg position. The reverse Trendelenburg position places the patient head and chest 30 degrees higher than their abdomen and legs, while keeping their hips and knees unflexed. In the semi-recumbent position, the legs are on the bed while the head and torso are positioned upright at a 45-degree angle. Due to the reduced blood supply to the neck, head, and gynecological areas, reverse Trendelenburg position is also used during these procedures. For minimally invasive upper abdominal procedures and better surgical exposure of the prostate, the reverse Trendelenburg position is also employed.
7th, the dorsal recumbent position. It involves a person lying on their back with their knees bent up in an outward position. The person will lie on the ground, bed, table, or resting platform while resting in this position. It allows medical professionals to examine and observe the pelvic area easily.
Lastly, the lithotomy position. While doing pelvic surgery or childbirth, the lithotomy position is frequently used. It entails resting your back with your hips flexed at a 90-degree angle. Your legs will be supported by padded footrest that are attached to the table, with your knees bent at a 70 to 90-degree angle. Regardless of the position chosen, bear in mind that giving birth is a complicated process with numerous possible pitfalls. Due to the baby's position in the delivery canal, the lithotomy position may occasionally be the safest choice.